Hello everyone, I am Dr. Nabil Eid from Anatomy Department, School of Medicine, IMU. Today I discuss the anatomy of thyroid gland. Here is the learning objectives where you should know the morphology of the gland, blood supply, related nerves, and embryology also. And also you have to know a common disease of thyroid gland like thyroid gland enlargement, we call the goiter, which could be hyperfunction, like we call it thyroiditis or hypofunction. The thyroid gland is basically formed from two loops, right and the left loops, which connected here, right loop, left loop, and connected by the isthmus here. There is another loop, additional loop called the pyramidal loop, which is sometimes not found. The thyroid gland is extended from oblique line of thyroid cartilage to extratracheal ring, and it starts from C5 cervical vertebrae to T1. As you see here, the thyroid gland is covered by some muscles here. Here is a thyroid gland. It's covered by muscles. We call it infrahyoid muscles. Later I will talk about it. But just remember that thyroid gland is bounded above by there is here larynx. Here is the hyoid bone, and just behind it you can find trachea. Here is the thyroid gland from behind. As you see here, from behind, you can find 4 parathyroid glands, which are located on the posterior surface of the gland, and you can see the esophagus here, and anterior to it there is trachea. Here's cross section, which shows the relationship of the thyroid gland. I mean, here is one of the loops. There is another loop. So here is the lateral surface or superficial surface, which is covered by a group of muscles. We call it infrahyoid muscles, sternohyoid, sternothyroid, and omohyoid laterally, and more superficial sternomastoid. Here is the medial surface of the gland related to the tubes, trachea, and behind it is esophagus here, and between them you can find the recurrent laryngeal nerve. The posterior surface of the loop is related to the carotid sheath and its contents, internal jugular vein, common carotid artery, and the vagus nerve. The thyroid gland is covered by facial sheath. We call it pretracheal fascia, which is connected to the larynx and trachea, and that's why the thyroid gland move during swallowing. Here we show here is the blood vessels of the thyroid gland. Here is the superior thyroid artery, which is branched from external carotid artery, and here is the inferior thyroid artery, which is branched from thyrocervical trunk, which is branched from subclavian. As you see here, superior thyroid artery is accompanied by a nerve. We call it external laryngeal nerve, which supplies cricothyroid muscle. Is an inferior another nerve which accompanies the inferior thyroid artery. We call it recurrent laryngeal nerve, which supplies the all laryngeal muscles except cricothyroid. As you see here also, the recurrent laryngeal nerve between trachea and esophagus. This is very important. Okay, and here is this slide we show the venous supply of gland. So here is superior thyroid vein, and here is the middle thyroid vein, which are tributaries of internal jugular vein, and here is the inferior thyroid vein, which is tributary of brachiocephalic. As you see here, the inferior thyroid vein also is accompanied by artery. We call it thyroidema artery, which is a branch of the brachiocephalic or aortic arch, and only found in 3% of people. That's all.
Okay, stop.
Okay. Here is side view, which show one lobe of the gland and its blood supply. Here is the embryonic origin of the gland. The gland developed from endodermal swelling called thyroid diverticulum, which is found at the floor of the mouth. And this diverticulum starts at 4th week of life and then descend down by the aid of thyroglosal duct. This duct draw down the gland to its final position below the hyoid bone and the larynx, and persistence of these ducts will produce some. Here, this slide shows the abnormal development of the gland and the related disease. As we see here, the gland, as mentioned before, it's developed at the floor of the mouth at this area we call foramen cecum here of the tongue. So if there is the gland didn't descend by the aid of thyroglosal duct here, so the gland may be stopped at the tongue. We call it lingual thyroid. It may be stopped above hyoid bone here, we call suprahyoid thyroid, or below here also. And as you see here, the pyramidal loop here is embryonic remnant of the thyroglosal duct. Excessive movement of the gland downward produce what's called retrosternal goiter. Yeah, here is the thyroid gland in plastic model. As you see here, here is the right thyroid lobe, left lobe, here is the isthmus. And you can see here is the inferior thyroid vein, which is tributary of brachiocephalic vein. And also you can see here is the external carotid artery, and branch from it is external superior thyroid, which supplies the thyroid gland from above. That's all for this. As you also see here, there is the deep to the thyroid gland. You can find there is a trachea here, and here is the thyroid cartilage. And above the thyroid cartilage, you can find the hyoid bone. Here is the plastinated model, which shows the right loop of thyroid gland. As you see here, here is the right loop of thyroid gland, and it's covered by two infrahyoid muscles. One is sternhyoid, is medially, and the other one laterally is superior of omohyoid. As you see here, here is the external carotid artery, and from it there is artery called superior thyroid artery, which supplies the upper part of the superficial surface and upper part of the thyroid loop. And here is my learning resources. Here is Gray's Anatomy, here is Moore's Clinical Anatomy, and here is my 3 papers. If you like, you can read my papers. If you don't understand these papers, ask me. Here is the histology. Try to study it by yourself. Thank you.